guys.
Hello.
Hello. Welcome to Fertility Talks. I'm Mary Wong, and I am the best-selling author of Pathways to Pregnancy, founder and director of Alive Holistic Health in Toronto, and your fertility health strategist and acupuncturist. So I am so super duper thrilled because today is part of PCOS Awareness Month. And why am I so thrilled? Because I have two lovely people with us today. One who is Ashley Levinson, known as PCOS Girl.
Girl.
G-U-R-L.
Yeah.
And you are an advocate and educator for PCOS and a former nurse, and you live in New Jersey. So thank you for being here. So awesome.
Thank you so much for having me. I am really excited and thrilled that we're going to be shining a light on PCOS for PCOS Awareness Month. So I thank both of you very much for doing this.
Oh, well, and I want to thank also, yes, thank you for saying this, because I want to thank Dr. Tanya Wild for being with us. And she is now my co-host for Embrace You First. And we get to actually shoot in something else because we're going to interview you on PMS. So watch out for that, guys, in the coming month or two. This month.
PMS
So
is real.
Yeah. And so Dr. Tanya Wild is a naturopathic doctor in Toronto and has been in practice for well over 15 years. And so super keen, has her own PCOS story, but I'll let you guys address all this. So let's just jump in, dive right in. So we'll start with Ashley, I suppose, and let us know, because as a PCOS advocate, actually, you know what we need to do? We need to back up. What the heck is PCOS?
Right. Yes.
Right?
Yes.
Actually, that's a good question, because a lot of people are still trying to figure that out. Doctors,
Right?
patients.
Yeah.
But I guess the definition of PCOS is that it is called polycystic ovary syndrome. But you shouldn't get confused. It is not just a reproductive disorder. It is a metabolic or endocrine disorder that affects multiple body systems. However, one of the main symptoms of PCOS, or I should say, one of the things that leads most people to a PCOS diagnosis is when they are trying to get pregnant. And they are having irregular periods. They are not conceiving after trying for a long time, and they go to their doctor and then they get the diagnosis of PCOS.
Yes, that's really, really, really important for you to say, because of course, a lot of people with PCOS, if they're not of the age of trying to conceive, they have no clue. They're just like, oh, why the heck am I not getting my period, right?
Or they might welcome it, say, oh, I don't have a period. Oh, that's okay.
Yeah, that's right. Yeah, I'm active. I want to be just like moving around. Who wants a period, right? But then there's a whole host of other things that goes along with it. Now, on the flip side, there are also people that have not been diagnosed, have had babies without trouble, and they still don't even know that they have PCOS, right?
Yeah.
Yes.
So, but both of you have been diagnosed. So I would love to hear from both of you what your PCOS story is. And because they're going to look a little different, right? PCOS, and by the way, just for those out there that actually has this diagnosis, I can't stand the name. Polycystic ovaries. It just doesn't sound nice. It needs to be renamed because it's not, and as you put it, Ashley, it's not conveying all that it is.
Right.
Yeah.
And I kind of agree with you about the fact that it's not the best name, but what I tell people is, if you just use the 4 letters PCOS, it really is no different than saying diabetes or stroke. It's more about the definition. We need a clearer definition of what PCOS is and how it affects people. And I think there'll be a lot more awareness and a lot more people that are going to build off of that when we have a clearer understanding. The fact is, we have no real universal criteria. We have different criteria from all over the place that have been defined and redefined, but we need to come up with a global initiative, a global answer to all of this that works for everyone, doesn't discriminate against people based on their age, their size, their background. So yeah, I think just bringing it home to clarifying that definition is the way to go.
So then let's talk about the definition. And certainly in our, medical types of practices, we do follow certain guidelines, right? So, for you.
Yeah, I use the Rotterdam
myself as
criteria. Basically, if a patient has 2 out of the 3 symptom findings, so you don't have to have an ultrasound that shows the polyfollicular ovaries. You won't necessarily see cysts. That's why I was just joking, saying we should rename it, because what you may see on an ultrasound, but don't have to see on an ultrasound, is lots of follicles, like a pearl necklace on the outside, so the periphery of the ovaries. But you don't have to have that finding because it's 2 of 3. And the other 2 more common findings you might see would be excess androgens, either found clinically, so meaning hairs on the chin, so hirsutism, hairs in place that we don't want as women, perhaps our chest, acne, so a clinical finding, even hair thinning on the top of our head. And then if it's not found clinically, you may find it via blood work, but there's so many blood tests that, in order to, see excess androgens, it could be testosterone, excess DHEA, dihydrotestosterone. So sometimes the testosterone total will look normal, but the dihydrotestosterone will be off the chart. So it's either a clinical finding, a blood test that shows excess androgens. So that's the androgen picture. And then the second thing is the irregular period. So counting day 1 of your menstrual cycle to the next day 1 would be more than 35 days apart or less than 21 days apart.
Right. And so some women, they don't even experience periods at all with PCOS.
Right. So that would count as the more than 35 days apart. It could be 60 days. It could be exactly not at all.
And then some just actually have very regular periods as well.
Yeah.
Right?
So I was more kind of under the radar because I was the kind of, I guess you could call slimmer sister, did struggle with weight problems, but my periods were regularly irregular. So I would get them 40 days and sometimes 50 and 60 when I was under a lot of stress, but they always happened. So I never missed a cycle. And typically they were 35 to 40 days apart. But I was actually looking in the mirror this morning and thinking, oh, I wonder if you'll see all my hairs because I haven't flexed lately. That is the one symptom that is so hard to treat. And unless you're using laser.
Right.
So even if you regulate the hormones, it does not go away.
Okay.
It's not
you brought up something. I'm sorry.
Yeah,
you brought up something really important, Tanya, that, you have what is considered lean PCOS. I obviously do not have lean PCOS, but that PCOS kind of can look different on every person.
Yes.
Exactly.
Yes.
Because I think a lot of people get into that mindset that you have to have a lot of facial hair, or you have to be obese, or you're not able to conceive, and it's just not true. The symptoms vary from person to person, so we have to look at each person as an individual and treat them as an individual instead of trying to lump everybody together under one umbrella.
100%. And this condition is going well beyond fertility years as well. So it's something that we need to address lifelong, right? So Tanya just literally a couple of days ago diagnosed me with PCOS, and I'm postmenopausal.
I did.
And
I fully had PCOS and didn't even know, or have it and didn't know.
Well, no, I mean, I was always going, I wonder, right? But still like it, and no one will ever be able to actually say that because I am postmenopausal. So
but both your parents have type 2 diabetes.
Yes. So that's what we need to
and then
actually
the
say.
irregular menstrual cycles.
Yeah. So
and
I
then
did.
acne. Yeah. Like
well, I didn't really have like, the one
cystic, but not having a period for a year.
That was when I went off the pill. Yeah. And prior to that I would
Which
get,
can do
but
that
anyway,
too.
so, and
Yes.
it can,
So
right?
the bottom line
So
is
again, it's like
sometimes
possible.
Hard to diagnose.
Yeah. It's hard to diagnose, but the point is for any viewer that's watching, I mean, so some of the critical things can still be with regards to like the whole metabolic issue, right?
The driving force,
and
they call it.
Oh, I like that. Yeah, it's the driving force. So
resistance.
say more
Even
about
if
that.
you're again a slim sister or a sister who struggles with I'm gonna get close and snuggly, being with weight issues. So insulin resistance seems to definitely drive it because when you with age and actually there's a statistic that I love that I got from PCOS Challenge, didn't know about it, which is basically 50% of women by the age 40 if they have PCOS will develop type 2 diabetes, irrelevant of size.
Of what age?
By age 40, 50% of women.
Wait, I'm going to add another statistic in on that. That by the age of 30, about 50% have are insulin resistant.
Yes, that's right.
And it won't necessarily show up.
And they may not show
you
up.
might not know unless you're checking insulin glucose tolerance tests. You know, your insulin's working as hard as it can. It's just that, I mean, your pancreas is working as hard as it can. So you might do a fasting glucose or a 3-month sugar average and see, oh, everything looks healthy. But then if you do the fasting insulin, then you might see that your pancreas is working extra hard because your receptors, the little locks are basically ignoring that little key, the hormone of insulin. So yes, I'm getting into detail. Sorry.
No, sorry. It's great. I think people should know, and you know, you want to be conscious. And again, like, you know, for those that are more mature watching this, it's like, oh, well, maybe again, I fit into this. Like, so I think it's important to know, right?
Yeah. But you know, what's funny is that I can speak from my own story, that I didn't try to conceive until I was 29 years old. At that point, it was already a done deal. I was already into a cycle with the way I was living, the way I was eating, and had no idea that there was a reason behind it. So yeah, I was part of that statistic. At age 40, I had type 2 diabetes, and I am now insulin dependent. And I would have known when I was a teenager or even in my early 20s that there was something going on, and that it could be corrected with lifestyle. It could be corrected with medications or with supplements, or, you know, however you decide to treat it. I probably wouldn't be dealing with a lot of the things that I'm dealing with now.
Right.
So
yeah, you know, that's very valid. And so you're really the early diagnosis is important, so that you can be proactive and take care of your health right now and into the future. So
I wasn't until 30 that I got diagnosed, and my doctor sat with the blood tests for a year, and he said, I'll call you back if there's anything abnormal. And when I went in a year later, not, you know,
louder.
Oh, louder. Right. So a year later, when I went in saying, my cycles are still irregular, I'm still struggling with, you know, hormonal cystic acne, and I'm going to start a family soon. Is everything okay? Did you get those blood tests back? And he's like, looks at the blood tests, and he says, you know, he's a great doctor, and nothing against me, he just didn't know what to do. He just looks at the tests, and he said, they're off the charts. I just didn't really know what to do. And I said, okay, well, thank you. He's like, well, you're the naturopathic doctor, take this and do something.
Okay, so that's interesting, you know, right? So, you know, you drive home another really important point. So who do we see when we consult physicians? It's the family physician. So the family physician, they learn a little bit of everything.
Yes.
So it's really not their job necessarily to know, because they, you know, come across everything. So this is where a little bit of education goes a long way. And then, you know, you might say, well, you know, if this doesn't, I mean, nowadays with the lab work, they'll actually give you the normal range and then an out of normal range. So if it's a little, and you can view your own, and then you can like Google, why would this be high? Or why would this be low?
Which
and
is
then,
helpful.
and then you can go back, because guess what? Your doctor is really busy anyway. So it's just like, I wonder if you could refer me to an endocrinologist.
And that's what
I
did.
That's exactly where you need to go, right? And that would be the proactive measure. And then from that, but then also know that in life and in the Western civilization, we have lots of options. So options meaning seeing someone like Dr. Tanya Wild, or as a naturopathic physician, or nutritionist, Chinese medicine like myself, or people at Alive. And so, you know, there's just lots of ways to deal with whatever you're dealing with. And this actually goes beyond PCOS now, like it's just overall, right?
And then accessing resources like PCOS Challenge, jumping back into PCOS, is amazing, who Ashley works for and advocates for. So
tell us a little bit about the PCOS Challenge and the organization you're with.
Yes, PCOS Challenge. Wow. They do So much. They advocate in Washington, D.C. every year with PCOS Advocacy Day. September is always a huge month. They have an array of events going on. They have national 5Ks. And if people want to sign up to do a virtual 5K, they can go to PCOS5K.org. You know, run at your own speed, walk at your own speed, but do it for yourself and to raise awareness with others around you. They have a gala and silent auction, which is actually September 13th. It is going to be a huge, huge, huge night. We have celebrities, we have members of Congress, we have leaders.
So how does that work? How does that work now in these times?
In these times?
Yeah.
Well, lovely things like Zoom and help us record and get people involved. And we're able to live cast the entire evening. It's going to be like watching, you know, the Tonys, the American Music Awards. I mean, this is going to be, people don't understand. I'm so excited, and I wish I could like show everybody, but this is going to be there. Yeah, it's going to be a huge, huge, huge event, and it's the first time that anything like this has been done on an international level, where basically anybody, providers, patients, supporters can attend this event.
Oh, so it's totally open. Okay.
It is totally open. And then there are 3 weekends that they are doing symposium with over 40 of the leading PCOS experts. So it's going to be September 12th, September 19th, and September 26th, and that's part of the educational series. And it's just like going to a regular conference where there's a whole schedule, and you can pick the rooms that you go to attend the different sessions. And then we're really just, everybody is, we have a Turn It Teal event.
Yes, I was going to say that. We are wearing teal. I don't know if you can see it, but yeah.
Landmarks around the world have been lighting up teal.
Yes.
To support PCOS Awareness Month. The past few nights have been amazing. The New York Stock Exchange went teal. Last night, the World Trade Center went teal. I mean, the Dublin Convention Center, I'm all over the world. And it's just, for me, as an advocate that's been doing this for over 20 years, to see even during these difficult times that people are lighting up for PCOS and recognizing PCOS, it's an amazing thing, and it's been a great year, and I'm looking forward to seeing where this all goes. But I'm going to stop talking about that. But if anybody wants to see the events, sign up for any of the events, you can go to PCOSchallenge.org, or you can go to PCOSawarenessmonth.org to see a full listing of events and to sign up for whatever you want to sign up for.
So because it's so prevalent, like let's address like how prevalent it is actually. So like in women all internationally, like what's their percentage, or 1 in what?
It used to, the quote or the stat used to be 1 in 10, but if you look at it globally, it's more like 1 in 5.
Okay, so that's huge, right? So if you walk in, well, you know, nowadays people aren't really going into Starbucks as much, but if you're in like, you know, if there's 20 people in the room, that's like 4 people right there. Like that's a lot, right?
So, if you're talking about a group of 20.
I'm just, you know, putting it into perspective, right?
My math.
It's okay, I'm a real math girl, it's all good.
And you know, in some countries like India, they're quoting rates of even 1 in 3 at this point. So there are some countries that are extremely, extremely high. And a lot of that has to do with culture and the fact that you don't really talk about conditions like PCOS in
not at all.
certain countries. So
and then the prevalence of type 2 diabetes in China.
Yes.
Yeah.
China and India are the top, you know, one of the higher ones for sure. And now the United States, right? So
we were even actually talking, we had a talk on World PCOS Day with leaders from around the world. And even in the Philippines, our Philippine leader was saying because of their culture, because of the way that they, with the foods that they eat, with all of the rice and the bread, and that it's very difficult to get that message across about what PCOS is and how lifestyle affects it, how intervention prevents it from happening. So I'm hoping that we can get those numbers down a little bit, and that the awareness is going to start getting out there.
Mm-hmm. Even going through my fertility journey, I was on that symposium, I believe I mentioned this, that I just kept quiet for those 8 years about what was going on. So it's not a cultural thing, it was just a personal thing. I mean, as a naturopathic doctor, I have this endocrine condition, but I was just almost embarrassed to share. And I just kind of went inward. And it was sad. Like, I was struggling to conceive, multiple miscarriages, and and helping other patients, which gave me inspiration. Okay, you're getting pregnant, my turn. I can do this, So since we're on fertility talks, I thought I'd bring it back to that, and how, it's like the ability to share now, it's one thing, but while you're going through the journey, oh my, it's hard. I don't know if you could speak to that, Ashley. But
I sure can. And that's really the reason that I started advocating.
Mm-hmm.
When I was trying to get pregnant, I had gone off the birth control pills that I was on for about 13 years. Yeah, I was age 13. I was having almost non-existent periods. And when I had them, I was just about hemorrhaging and in severe pain. And I walked into my OBGYN's office and at 13, and he basically just put me on the birth control pill. And I remember to this day, he said to me, "Girls sometimes your age have a hard time growing into their hormones. Take this pill every day, and when you're ready to have kids, come back and see me." And that was it. Not even a mention of PCOS or anything. Just stay on the pill until you're ready to get pregnant. So move forward, age 29, I go off of the birth control pill. And literally within 3 months, I had put on 100 pounds. I started getting the facial hair, had the irregular periods again. I was, desperate. I didn't know what was going on. I went to about 3 doctors, and, I was told, "Oh, you're just stress eating because you're trying to get pregnant. If you just lose a little weight, maybe you wouldn't have a problem." And I'm like, "You don't understand. I've never been overweight before in my life until I went off the birth control pill."
Right.
So finally, I spoke to a doctor who actually listened to me, and he had just finished his residency. And I told him my story, and he walked out of the room, and I'm like, "Oh my goodness, something is like really wrong." He came back with a textbook and opened it up. And there I was faced with what I would be dealing with for the rest of my life. 4 little letters, PCOS.
Oh, wow.
And he said to me, "I don't know much about it, but I'll learn with you." And it made me angry. And he told me that I had a choice. I could either choose to get healthy or lose weight with PCOS, or I could try to get pregnant. And since I was, a young woman, I had always wanted to have a family. So my decision was to try to get pregnant. I went to a reproductive endocrinologist, and we did a couple of rounds of Clomid, and I was fortunate enough that I was able to get pregnant with my daughter on the Clomid, but I had to do progesterone for 3 months to maintain the pregnancy. And fortunately, I had my daughter. And then after that, I said, "I'm going to get healthy with PCOS." And I started seeing a doctor, Dr. Catherine Sharif, she runs the PCOS Center in Philadelphia. And she started me on lifestyle and supplements and medications. And I started losing weight and got really healthy, and got pregnant again with my son. So I was fortunate that I dealt with infertility, but found that there were options when people listened and offered different options to me to be able to become pregnant.
Yeah, and certainly that we see a lot of that, right? Women going through fertility challenges and I don't know the percentage, but I certainly see my fair share of women with PCOS having challenges.
For
That's
sure.
not to say that all women with
That's
PCOS
right.
has
I
fertility
think the
challenges.
statistic is 70% do, but 30% do not. And I see a lot of women with PCOS that find out after they've had children. So
Right.
we don't want to,
Yeah. And as much as we want like the ideal cycle, so we see women that will still have a healthy baby to term, even when they're not having their regular cycles, like, even 3 months. And it's like, oh my gosh, and they still somehow got pregnant, right? So it does happen. But, having said that, it's like, especially if you already know you have it, then this is a really good time to look into yourself and think of not just about trying to conceive, but really like long-term consequences, because we know there are more risks associated for other types of ailments in the future, right? Do you guys want to take that on, like list some of the things?
Yeah. Sure. I can list a couple of them. There is a 7 times greater risk for heart disease. You are doubling your chance for endometrial cancer. You have a 4 times higher risk of stroke. There is an increase in hypertension, in lipid panels. There is
high
also
blood pressure, high cholesterol.
High blood pressure, high cholesterol. Then there's also another component of this that is often overlooked, is it also affects mental health as well.
100%, yes.
Yep. 34% deal with depression and 45% deal with anxiety with PCOS, which is huge. And that's something I think if I had to hit home a point with anyone who is treating PCOS, it's to look at the emotional and the mental health that goes along with PCOS as well.
So important for you to address this. And then I want to actually add in. So imagine a woman with PCOS taking hormonal drugs at a fertility clinic, right? So oftentimes we'll see women go like, oh my gosh, I don't even recognize myself anymore, because, now you're on like crazy extra hormones.
I actually did really good when I did my IVF.
Oh, you did? Okay. So
I joked with you. I was like,
that's
jacked
right.
up on estrogen 10,000 for my IVF. And or maybe it was the mindset shift. I don't know, but I just told myself that I was going to feel okay, because I was just so resistant to do IVF in the first place that when I finally did it, I said, okay, when I'm injecting myself with this, gonal or whatever FSH analog, that it was like purple magic potion that was going to plump up my ovaries and make them juicy and healthy and create a baby. And I did create one. So
yes, you did. Yes. And
and I did feel okay, but you're right. So I see, but I mean, I'm not going to lie. I had swings through the entire fertility journey where it was up and down, and there was grief, and there was, I think with the higher testosterone, your irritability is out the roof sometimes.
Can be exacerbated for sure. So we don't want to undermine what you feel at all in any way, because what you feel is real. And that is going to be a segue to our next topic. Well, for our Embrace You First. So come and check us out in a couple of weeks, because we're going to talk about PMS is real and worse with PCOS. All right. So I think this concludes our chat today. And so if you want more information, please check out PCOS Girl on Instagram. You can people contact you? No problem.
People can contact me. This is my heart and this community and everybody who deals with PCOS. I'm here. You're not alone. Please reach out.
And I have to thank you, Ashley, because of you, I feel so much more connected to the community. I know that, it's like a one-on-one background conversation, but years ago when I connected to you and reached out to you, I just felt like all of a sudden I was like, oh, people get me. They understand what I'm going through.
Yeah.
What you do is huge.
I want to be part of it.
You are part of it. You are part of the inner circle.
You are.
All right. Okay, guys. Thank you. Please share, because this is such an important conversation. Tell everyone you know. Share this post. Like this post. Scroll down. Subscribe to the YouTube channel. Check us out. And then again, check Embrace You First podcast as well. And that's audio and video. And so we're going to talk next about that, but that's off this camera. So have a great, great, great day, and we shall see you soon. And by the way, if you have not reached out and grabbed your copy, please do so. Pathways to Pregnancy. It's now also on Audible. So it's my voice.
Mhm.
And there's 15 stories of hope. And there is a story on PCOS for sure, because it is part of the journey.
Nice.
So thank
And
you.
so soothing your voice. Really, no.
Okay.
Thank
All
you,
right.
everybody.
Bye, guys.